Good evening, everyone. It is Thursday, June 4th. Hope you had a great day out there. It's beautiful. I love this summer weather. I just finished a little workout and I'm still a little warm. So I guess if I look a little glistening, that's why I still haven't fully cooled down, but I wanted to get this broadcast put together so everybody could have it before it was too late in the day. Let's take a look first at our testing. We have tested 5,460 patients, 4,848 negative results, 486 positive, 70 indeterminate. Our cumulative positive rate sits at a flat 9%, and the state sits at 16.5%. Our 10-day rolling average has slipped down a little tiny bit to 3.37%, and the state is at 6.47%. So that spread that we've seen throughout the pandemic continues. And so, if we can keep our rate low, that will be fantastic for us until we have a vaccine that fits the bill for all of us and keeps us safe. Statewide, 614,133 have been tested. And in Worcester County, we are at 11,465 cases total with 804 deaths. Franklin County at 335 total positive cases with 47 deaths. Last night, I didn't have my inpatient stats for you. So this morning, when I got to work, we had 8 positive patients with COVID-19 in-house, 7 on WalkIns 1 and 1 in our ICU, and just 1 patient under investigation. As of this evening, we are at 6 positive inpatients, 5 on WalkIns 1 and 1 in the ICU, and we are at 3 under investigation. So we've discharged a couple of patients over the course of the day. Just some acknowledgements. Oncology, we haven't given them a lot of shout out. They've been quietly going about their business throughout this pandemic, and we want to just acknowledge their continued support throughout, making sure that our patients are having a calming voice. We've been teaching them how to use Zoom technology, and they have just been really the calm behind the curtain, making sure that our oncology and hematology patients have the care that they need. They certainly exemplify our heart culture, and we appreciate the professionalism they've had throughout the course of the pandemic, and a shout out to all of them. Also a shout out to our entrance control team at both hospital campuses. We appreciate everything that they've been doing. It's a challenge, especially when we have surges of patients coming to both hospitals, and we appreciate your patience as we screen you before you enter. That's something that we need to do. We will keep doing, and encourage you to arrive on time for your appointments, not too early and certainly not too late in this day and age, to make sure that we have you queued appropriately so that our waiting rooms are not crowded and that you can get in and out for the services you need. Also, we are providing COVID-19 testing to anyone in the community who is interested in that. That volume is continuing to grow. You need an appointment for that. You can call 630-6186 and get scheduled for that. You do not need to see your primary care physician first or go to urgent care. However, if you have symptoms, you really need to talk to your primary care provider and or go to Tully Walk-In Care or Haywood Urgent Care to get screened prior to having your test. And remember, when we do your test, and if you have a primary care physician affiliated with Haywood, that information goes directly to them so they can counsel and support you after your testing, and we have that information in your electronic medical record. We do have some employment opportunities that have come about during this pandemic that we didn't necessarily have before. One is entrance control, as we try to standardize that and actually have positions to fill that versus asking staff from various disciplines to man our doors. We were looking for folks to do that. And also our environmental services team on both hospital campuses needs some additional staff as well. So if you are looking for employment and those 2 opportunities call out to you, visit haywood.org/careers. You can also email directly humanresources@haywood.org and learn more about that. Just a reminder that we are safer than ever before. We have enhanced cleaning and disinfection going on in all our facilities, all our practices, and increased work of that. We have our 2 ultraviolet machines, Amber and Parker, who disinfect rooms using ultraviolet. We also have 2 more of them on order, and hopefully they'll be with us soon. We call them they, we name them, and they do fantastic work. And in 15 minutes, they destroy virus on any surface throughout the hospital. So we use it extensively on our inpatient units, our exam rooms, and in our emergency department. So that really falls greatly on the shoulders of our environmental services team to make sure that that happens. And so a shout out and thank you for that extra work that you're doing. Just remember, we have a strict visitation policy, and I know that is frustrating for some people. One, that is actually part of the governor's order. Two, we want to limit the flow of patients and visitors going through our facilities. So if you are coming to see a primary care physician, if you do not need support, obviously, if you have physical limitations or the patient has cognitive issues, you just need to speak with the people that are making your appointment, so we have your name at the front door so you can be escorted. Everybody who enters needs a mask, and if you don't have one, we will supply you with one. Our PPE pipeline is solid right now, in large part thank you to our community. We also, you hear me talk a lot about WalkIns 1. WalkIns 1 is the one unit at Haywood Hospital where we cohort our positive patients together so that WalkIns 2 and other parts of the facility can remain COVID-free, as well as Athol Hospital so that Athol can take care of especially some of its long-term swing bed patients. So just a note to the community on that, and just reminding everyone, staff and visitors and patients, to foam in and foam out whatever door you happen to come in or exit the facility. And also, we have enhanced our pre-screening for any surgical patient coming in for surgery or endoscopy procedure, and we test all of you 4 days before you come in for that procedure. So we are safe, we are sound, and we appreciate the community coming back to us. I also want to point out that tomorrow, Friday, in Gardner, there is a Black Lives Matter peaceful demonstration and march in our community, which I hope folks will participate in. And as I spoke earlier about what is going on in our country, I hope that we are a shining example for peaceful demonstration in our community as we support those in our community who feel the racism that exists and the discrimination that exists, not only in North Central and North Quabbin, Mass, but across the country. And so if you're going to be out there, please be on your best behavior, wear your mask. We've seen a lot of these marches going on around the country, and thankfully a lot of people have been wearing their masks, but again, you're going to be in close proximity to people, so let's be smart and let's be safe and let's keep the disease load down in our community. We have done a fantastic job as a region, and I don't have the comparative to other parts of the state, but we are definitely a shining star, and so let's keep that up. Let's keep safe and let's support one another in the process as we continue our journey to be one of the best community-owned health systems in America. Good night.